Thanks. I'm going to be talking about data. I'm not going to be talking about health nearly as much as any of the other speakers today, but I do hope that I'm here for a pep talk. So when I worked for the federal government, I was at the Census Bureau, and I was in charge of building and then leading the unit that identified administrative data sources, got the legal agreements to bring them into the Census Bureau, to do the entity resolution or the person-level data linkages, and to figure out how to improve statistics using all of those data sources. So we're talking about population-level data from HUD, from VA, from SSA, from IRS, from Medicaid, Medicare, and CMS data, and how to improve the surveys, how to deal with the fact that the quality and coverage of the surveys was slipping over time. And most of all, working at the Census Bureau, you're really concerned with the denominator that made all of his maps possible. So you want to make sure that you're getting adequate, quality, reliable data from the population to be able to have all of these measures, to understand prevalence, et cetera. Now I'm at Georgetown. I'm in something called the Massive Data Institute, where I focus on access to data, governance. So where are the data coming from? This is what I'm going to be talking about a bit today. How burdensome it can be to get the data, to prepare them for use, to make sure that you have consistent, reliable, representative data for the entire country. I'll be talking a bit about some of the data sources that I have experience with and that I think would be useful as you think about the indicators that you'll be considering. And then, as Ed already pointed out, the quality issues whenever you're looking at these data, especially knowing that you're going to need to see them longitudinally. So looking at the literature perhaps on how you assess data quality for these population level data that are being pulled up from local areas sometimes. And then finally a bit on measurement issues, and that's kind of my thought exercise for you. Instead of saying where are the data, think what am I trying to measure? So where are the data coming from? You need to make sure that you're recording this whenever you get data in. Is it something that I said? Is it something that my clinicians said? Is it something my landlord said? Those are really important when you think about the validity of the data and how much drift it's going to have over time. There are a lot of sources that are funded by the government, that are collected in the private sector, how you can use them in concert, not just one or the other. When and how data are collected is really important. Was it collected at the end of a long doctor's visit? Was it collected face-to-face with an interviewer where I might have some stigma about the response that I'm going to give? Or is this web collection, which may reduce some of the stigma problems, but then you have a different equity issue because not everybody is going to have access to the internet or broadband to be able to answer questions online. When you think about how to look at data in the longitudinal sense that you guys had just mentioned with the previous panel, are you going to be collecting data from the subjects actively, or can you collect it passively through data that they've provided to other agencies or to other entities? So how much of a burden is it to them, and do you have the proper consent in order to do linkages to pick up data from different sources? And finally, just reiterating, are you getting that information at a single point in time, or are you attempting to track something over time? And when you think about an indicator, instead of that indicator being, this is the difference between Alabama and Maryland, it's over the past 3 years, this was the change in these counties in Maryland as opposed to these counties in another state. When I was at the Census Bureau, I had dozens of people that were doing the work described on this slide. Whenever you're seeking to come up with measures, especially measures for every county or every state, it's critically important that you have really robust methods to normalize the data. You're pulling it in. You want to make sure that you understand the data. You're documenting the data. Doing data linkage was a big part of what we do, and there's a great linkage program at NCHS already and also at some other federal agencies, because you really want to make sure that you're creating meaningful measures. Early in my history at Census, I was fortunate to work on the experimental poverty measure. That was where you're looking at the official poverty measure, which is based mostly on dollars, and trying to figure out what other data you need to bring in there to get a fuller reflection of taxes and transfers, for instance. you had to take data from other sources and figure out how to blend them in. And you had to have a documented process, and you had to make sure that it was going to be repeatable over time. When you're doing that, it's often important to integrate data, meaning you get it from lots of different sources, and you figure out how to join it appropriately. Is it going to be joined at a person level, at geography levels, and if so, which and how often? Or when you're thinking about, as Ed was saying, the data that are being rolled up from communities, rolled up from cities, is there a way that you can federate that data? Because when you're running a data linkage operation, you can either be the vacuum cleaner that's pulling all the data in and then you have it and you link it, or given technology today, there's a way that you tap into the data where it lives in a federated data system so that you'll be able to, if you have a common schema, join that data with likely higher efficiency and lower risks of having the data all pulled in one place. So data sources, I'm going to walk through these one by one. These are the ones that I think are important, and they also map very closely to what you've already heard in the previous panel. For surveys, there are a number of them collected by the government, especially those by HHS and NCHS. Then there are a lot of them collected by the Census Bureau. So how do you get access to those? When I worked in government, it was my belief that if something wasn't illegal, it was on the table. That was not a common belief within government, but it really made you realize that if you wanted to link data, as I did with NCHS and with our colleagues at USDA and the Economic Research Service, how you do it is a matter of just slogging through the bureaucratic process to get access to the data, to document it properly, and then to use it responsibly. The same thing can be done with private sector data. It's just that little bit harder, because you're not entirely sure what the private sector has collected. It doesn't necessarily have to have the transparency that the feds do. There's no OMB package for what they're collecting whenever you're looking at data from the private sector. But I'd urge you to look at those data sources, whether they are surveys or, as my next slide will be about, their administrative data, to think very broadly about how you would be able to blend data to capture the essence of what you're trying to measure. And linkages are going to be critically important in that. Administrative data, that's where I've really spent most of my time. I was looking at the federal data sources, but when I was at Census, it was very clear that a lot of the action was happening below the federal level. And I was knocking on the doors of every state saying, may we get your SNAP data? May we get your TANF data? And it was great at Census because we had the legislative authority to request that. The states could, of course, then say no, but at least I had the ability to ask. And I think it's important also to think about, if you're going to be looking for these data pools from different agencies, to get people started right away on looking at the legislation, looking at the regs, to figure out where you have the latitude, and then where you have a barrier that might not be based in law, but it's based in the culture of the organizations. So with the state and local data, I noticed that at Census, we were getting deliveries of these data, and they had poor documentation, and the data were changing over time. And my staff and I would be very frustrated, and we would call them, and they say, look, we're just administering SNAP. We're running a program. We didn't plan on you guys using the data. We didn't need to make a code book for the Census Bureau to use the data 6 years down the line. So when I left government, it was to focus on this, because the transactions and the encounters, they're happening at that front line. They're happening not at the federal level. They're happening state and local. So how can we have, as Ed was saying, something like a movement to this new paradigm of having data, massive data perhaps, and what would be needed, what standards are needed, what guidelines, what norms need to be out there to facilitate this. And especially with private sector data, you might not think of proprietary firm data as administrative, but it's what they collected in order to run their business. So it is. You just might not have as much documentation as you do with the government data. When you're looking at these sources, it's important to figure out if you're going to need to be looking historically, or if you want to get a relationship set up so that you're going to have ongoing accrual deliveries of data. This may be important if you're looking at socioeconomic status. Do you want to know about the educational attainment or occupation of my parents. Is that possible to get passively? Is it ethical to get passively? That if you have this cohort of people you're looking at, how far will you go through data linkage in order to create that richer picture that might be really essential? But I think that there are important security, privacy, and ethical issues to be addressed, knowing that you would be able to get really rich information at that individual level. We've heard a bit about place-based data or environmental data. When you look around and you see the sensors that are all over the place, whether those sensors are capturing images or they're capturing pollution, or you're talking about shot spotter that's capturing gunshot, acoustical sensors, you can look at land use over time cadastral data that really doesn't exist well in this country, but is that useful? When you're thinking about the place-based data, you need to make sure you have the analytics to be able to turn that into information or perhaps indicators, but that's there. We need to build bridges between, I think of them as the health sciences, the social sciences, computer science, data science, and statistics. So when you have these different approaches that are being used to join data and to analyze data, especially from these new streams that are just an enormously high volume, you need to be able to reach across those disciplines in order to have the absolute best practice that's out there. It's the same thing with gauging measures of the economy over time. So again, the benefit of having that longitudinal view is critical. Community-generated data. So there are a bunch of people doing natural language processing on Twitter data, on Google searches, on Yelp reviews, and that's interesting and it's publishable. But is it something that can be used for national statistics? Is it something that can be used for indicators? And right now that answer may be no, but you're looking at Healthy People 2030. So as these platforms evolve, as the technologies evolve to be able to gather more insight from these streams, this may not be in your core, but this may be in your research agenda of how these are being used and whether you can get community-generated data that have value. It may have value whenever you're thinking about the civic engagement piece or the social isolation, how connected people are to each other. But these are very difficult, non-representative streams, and they are likely to change enormously over time. But that doesn't mean that they should be discounted at this point. What are the data of the future? You're being traced right now with your phone. Your location could be important. There are wearables, Fitbit, there's the Internet of Things, what's in my refrigerator. There are a lot of people doing these 23andMe or Ancestry genetic testing. There's just this wealth of data that had not really been out there when you were probably considering indicators 2 cycles ago. Again, as with my previous slide, are these important? Are they relevant? I would say they are relevant. They may not be important right now, but I think it is important to think about how you can harness the information that's in there. There are likely to be generation-specific approaches here. Somebody not being attached on social media probably has much more meaning for my teenagers than it does somebody in their 60s. But how you get that needs to be mined, again, across the disciplines. How is that being looked at by other sciences, like the social sciences? And then the data of the future, it may live where it was collected. So secure distributed applications, this is where you would be able to have encrypted computing on data, where they are collected, where they live, without it having being pulled together into an honest broker or trusted third-party environment. So there are methodological changes that will impact where the data could come from. So data that might have been viewed as off the table could be put back on the table because of privacy-enhancing technologies. And so I think that it's important to consider and track those things. Again, it's the cross-discipline. Those are happening in computer science. You need to make sure that you're observing how they could have applications in the health sciences. You want all the data you're using to be reliable. You want it to be consistently available, and you want it to be representative. those are just givens. You need to make sure that you're doing the research to ensure that you would understand whether you have the outlier in the data. And this is my thought exercise piece. Instead of just looking under the lamppost for the data that are sitting there, to think about these issues that you might want to measure and then how you would get data. You know, where would you seek the information, and would you be able to join sources in order to come up with meaningful indicators through some of these things that we've already heard about in the previous panel. So, thanks.
What timing. Thank you very much.